All right, good morning, everybody. I'm so excited to have Brandon Chen here with us today. He works with our local community PACE program provider, OnLok. OnLok has been a steady community service entity in our area for years and years and years, probably more years than Brandon.
Definitely, definitely.
Um, so, and it's an integral provider of services for the seniors in our area, all of our seniors and their families, because they're a great resource that families can rely on for their senior family members. So I'm going to introduce Brandon, and he's going to tell us all about OnLok today. The one thing I did want to point out that this kind of program, although it's unique and local here to San Jose and Santa Clara County, in everybody's county and everybody's city, in the municipalities, they have the same or similar type programs stemming from the PACE program. And he'll explain more about that and how you guys can look up in your local geography similar the PACE programs, which is California, right? California is sensitive or exclusive. I don't know. He'll explain. Anyway, all right, Brandon, I'm just going to stop talking now. You can talk now.
Okay, thank you. Thank you for introducing me, Julie. It's nice to see everyone here today. Again, my name is Brandon Chen. I am an enrollment and outreach representative with OnLok. So that means that they're essentially my role at the company is twofold. First off, I work with community partners just like today to try and spread awareness about OnLok, about the PACE program, to host community events also in person. I'm going to a 4th of July event later today, and I'm trying to go there to, hand out some flyers, engage with some of the seniors there. And then the other part of my job is where I work directly with the seniors that are interested in the program, and I kind of act as a liaison between them and the center to guide them throughout that process of changing health plans, which can sometimes be very intimidating. It can seem like a lot of work, and so my goal is to make it just as streamlined as possible for them, make it as easy as possible. So today I do have a little slideshow. I'm going to share my
Oh
screen,
yeah, me too.
and
I got you. I
and
fix
my
you.
co-host.
I fix you up.
Thank you. I'm gonna walk us through this slideshow we have. It's a lot of information, so I'm just gonna touch on what I think is important for everyone to take away. Let me see if I can do that real quick. Let's see. Should be. There you go. Let's see. See if everyone sees that there. And then let me start the presentation. Does everyone see it?
Yep.
Okay. And then how about now? It's
Yeah.
good?
Yes.
Great. Okay. Thank you. So again, this is an overview of OnLok Pace. I'm going to explain from the very beginning what is OnLok, what does that name mean, and also what does Pace mean. So these are all words that we might hear, but we might not necessarily know the origin or know what exactly they mean. Okay. Okay, so to go over some brief history here, just like Julie said, we have been around for a very long time, over 50 years now in the Bay Area. OnLok as an organization was actually founded in 1971 in San Francisco's Chinatown. It was founded by two people in a partnership, Dr. William G. and a social worker, Maria Louise Ansack. And the two of them really came together with the concern that at the time, for a lot of the aging seniors in their community, the go-to solution that families had when they realized that these seniors were losing their independence was to send them to a nursing home. And so that was a big concern because once they go to a nursing home, a lot of times, and I'm sure you all know well, they'll start to lose their independence very quickly. They're, housed in that facility, they lose that independence, they lose some of their freedom. It starts to affect a lot of their health, mentally and physically. And so they came together with the idea that we should not have to jump to conclusions and send our seniors somewhere that is, displaced from our community, and they should be able to age gracefully. And so that's when they created one of the first adult day healthcare programs, and they created the PACE model. So PACE stands for Program of All-Inclusive Care for the Elderly. That is what PACE stands for. And OnLok is actually coming from Cantonese. On basically means safe, peaceful, and Lok in Cantonese means essentially joy or happy. And so the full name of it in Mandarin is Anleju, Unlock Ju, and so the last word Ju means basically housing. And so the meaning of that original name there is allowing seniors to be safe, happy, peaceful in their own homes rather than moving them somewhere else. And from there, as you can see in this photo here, there were a lot of rallies, and they were able to secure federal grants. They were able to create the National PACE Association, which we know today. So moving forward, we were started in San Francisco County over 50 years ago, but as the decades passed on, we were able to expand all the way over here to South Bay and some of East Bay. And so in terms of what OnLok Pace services today, it is all of San Francisco County, all of Santa Clara County, and then what we call the Tri-City area in East Bay, which is Fremont, Newark, and Union City. As you can see, we do have PACE centers. We also have alternative care settings. PACE centers are really what makes it all work. That houses all of the services that we have that I'm going to introduce as well. But we are planning to expand, open new centers. So who knows, the service area could be subject to more expansion moving forward. So like I said, that's PACE right there. Um, Right now, I really want to touch on, what sets PACE apart from your traditional health plan? What makes it have such an advantage in terms of seniors? In my opinion, I've been at Unlock for a little over a year and a half. I was just telling Julie, and I've been able to have the privilege to enroll many, many seniors into our program. And really, it's just a high touch. It's a very personalized care plan in terms of having a team, and that team is actually monitoring each member's health 24/7. And so, you can see here in terms of it being a wraparound service. It's not just the medical care, the, hospital visits, the ambulance, but we actually do cover many other different services under the same program, including home delivered meals, home care, similar to IHSS, medication delivery, physical therapy, activities at the center. So all of these services are provided under one program, which at the end of the day, really is able to save time and that effort in terms of, a lot of times when a senior is aging, they start to rely on their family to, provide that transportation, to schedule their appointments, to remember they have these appointments, and also find different doctors that accept their insurance. So a lot of times that creates a burden on the family, which can lead to, caregiver burnout, a lot of issues there. Our goal is to create a working relationship with the family to lessen that burden and again, allow that senior to continue living at home as long as possible. So like I said, the PACE centers are really what makes the program work. And again, you can see here all in one place. So sort of like a one-stop shop kind of deal. You can find all of these different services under one PACE center. And so generally speaking, with people that are interested in our program, I do start with a tour of our center just to give them a, hands-on experience to be able to see these are our current participants. This is what our activity center, our rehab, our clinic looks like. And, to get a feel, is this something that you would be interested in, that you can see yourself doing? So I touched on most of these already, but really it's a matter of convenience and a matter of having that easily accessible, especially with transportation always provided as well. Meals are provided, and the meals are actually managed by our own dietitian. And so, we have participants with high blood pressure, diabetes, kidney disease. They need to have specific, nutrition adjustments, and we are able to provide that as well. So ultimately, in terms of the medical care, we actually house not just our family doctors, but also the dental, podiatry, audiologist, optometry. So we do have a variety of specialists within the clinic. And then outside of that, we also partner and contract with other specialists outside of the center, and we provide transportation as well. So it really is, all of these different services under one program, and we have considered a lot of these different facets that are important, especially because as seniors get older, they need to see more and more different specialists, and that can cause more of a hassle. We provide the transportation to the specialists, we provide the referrals. And we can even provide interpreters. A lot of our members don't speak English as a first language. They might struggle with communication, and that's one of the reasons why they always need family with them. Now that we have an interpreter going with them and we provide the transportation, the family can rest easy knowing that their senior is being taken care of, and that we're following up with them on every step of their healthcare. So, in terms of what sets PACE apart, this is what we call an IDT, interdisciplinary team. Every member in our program is assigned their own IDT. And so what that means is they're doctors, but also they're drivers, dietitian, they have their own social worker, the director, the activities. These people are constantly communicating 24/7 and they're managing their health. And so having this level of communication versus a traditional health plan where you'll have your dentist is in one city, maybe your diabetes specialist is in another city. You're having to see several different doctors, specialists, PT, and they're not working together at all. They're all separate organizations. Under PACE, you can rest well knowing that these people are all coordinating your care, and so they know exactly what's going on with you. And it's also very much a focus on preventative healthcare, in terms of preventing ER visits, preventing falls before they can even happen in the first place. Now, I know you're wondering, who do we target? Who is our demographic? What do our members look like? In terms of that, surprisingly, 55 years and older, we do have a wide range of participants in terms of age, in terms of demographic. For example, the youngest senior I've enrolled in the program so far has been 56. The oldest senior I enrolled in the program was about 97. So we do have a very wide range, and we are able to take care of all sorts of different care needs from all of these seniors. In addition to that age requirement, they do need to live in that service area that I touched on previously. Um, they need to be able to live safely in the community, and that just means there's no risk of violent behavior. They have stable long-term housing. And the third one there that you see might raise some questions. The wording of it needs a nursing home level of care. And so when a lot of people hear that from our program, they tell me, oh, I'm not quite there yet. I'm not ready for a nursing home. I don't need your help. But actually, to the contrary, we're not looking for people that are nursing home, suitable at all. It sounds confusing, but essentially, level of care is what sets that apart. The California State Health Department actually has from the Medi-Cal department, they actually have people reviewing every case that's trying to come into our program, and they need to meet a certain level of care. And so what does that level of care mean? What does someone need to have to meet that level of care? What I typically like to tell people is that there are two really main things that they look at. The first thing, of course, is going to be your health history, your chronic conditions, if you've had a history of falls. These are all good signs that you do need more help from OnLok. If you don't have any illnesses, you don't have high blood pressure, diabetes, arthritis, you might seem a little too healthy for our program. The second thing is become a lot more pivotal over the last year or so, and it's what we call activities of daily living, or ADLs. ADLs lately have been really the I want to say, the game changer. It's really been what essentially sets someone either to be approved or not from the state. And so what we're looking for is people that have sort of lost some of their independence and they're starting to rely on their family member for things like transportation, appointments. Maybe they can't cook anymore. There's a risk of leaving the stove on. Maybe they've had some falls. They need some help sometimes with maybe getting changed with stairs. These are all things that are indicators that they do need some more support and that they're more likely to be suitable for the PACE program. If they are fully independent, even if they have health conditions like high blood pressure, high cholesterol, if they're fully independent, lately that's been the case where they're still considered too independent for our program. So just to give you guys an idea of, who's more suitable. I know this is a lot of information, so I'm just trying to touch on some points, but feel free to let me know if you have any questions towards the end. We're almost done with a lot of this basic general information. So I just want to touch really quickly on in terms of how does it work of joining our program. It does take usually, if everything goes smoothly, less than a month. So we are openly enrolling and having new members come in year round. And again, they mostly work with me, an enrollment representative. And so, I'll give them a tour. They'll be assessed by our nurse. After the assessment from our nurse in their home, that's when we wait to see if the state will give them that approval. So really, that state approval is what makes the difference in terms of can they join the program or not. After that approval, they'll have an assessment in the center, and then they'll be enrolled in our program. So it's a very straightforward, kind of process that we've streamlined for them. And sometimes there can be complications, but that's what I'm here for, is to smooth out. So I know you might be wondering, what is our capacity to take care of our seniors? These are some numbers for you here. We are contracted across these three counties in terms of hospitals, specialists, nursing homes, RCFEs. And so we do have a very expansive network, and we are able to cover all sorts of care needs and different specialists that we can refer to as well. So I was talking to Julie a little about senior real estate, and in terms of what some services that are provided as well. And I found that really interesting because I do see some connections with that. I mean, in terms of a lot of times the seniors that I've worked with, they don't own a home. A lot of the seniors I've worked with, they live in their children's home. And a lot of them might be immigrants. A lot of them might not speak English well as a first language. And sometimes they, in some cases that I've experienced, the children might even buy them a separate home or have an ADU for them. So I can see some crossover there in terms of the seniors. Maybe they live by themselves in their home, which can cause a lot of problems in terms of a fall risk, who's there to support them. And so that's what OnLok Pace is there for. Something I touched on earlier was the home care. And so we can send caregivers to their home to accompany them. And then when our caregivers aren't there, we can actually bring them into the center to have activities, socialization, to have a warm lunch. And so we really are there to provide company to them, to take care of them, to make sure that they keep their independence. Now, this is just a form that we have. This is the digital version, but we do have a little bit of a referral form. And then essentially, I bring these to a lot of events, and for people that are interested or curious about how to learn more, that's some of our information there as well. Yeah, I know that was a lot of information about OnLok. Again, I just wanted to touch on some of the basics, but please feel free if you have any questions to let me know, and I'd love to, learn more about each other's organizations. Thank you.
Does anybody have any questions, comments, observations?
Brendan, hi, I'm Jessica Solomon. I was 20 years in home care. I was a marketer for them. So when you said you
Okay.
provide caregivers, is
Yes.
that are you partnered with are you outsource that, or is that your own employees?
Good question. Yeah. So I'll kind of briefly go over that. To answer your question, first off, we do have our own caregivers. So it is not outsourced. We actually have on-lot caregivers that are going out to the seniors' homes and taking care of them. A lot of times people will draw comparisons between our home care and IHSS, which I'm sure you're aware of.
Yeah.
IHSS, they'll grant up to, 150, 200, 250 hours per month. And a lot of times, from my experience, the caregivers will spend a good chunk of that time just providing company to the seniors. And so they'll be there to monitor them, remind them to take medications, just be there with them to provide company, especially for seniors that are living by themselves. The difference between that and our home care is that our caregivers will go to their home and they're very task oriented. So they'll help them with groceries, some cleaning of the house if they need help showering. And then because they have to cover many members' homes, they're not as much able to provide that time to accompany them. And so our goal is to supplement that time by bringing them into the center for activities. And so our activities room is actually open Monday to Friday, 8 to 4:30. And so if they are granted attendance, they come in, and we even have things like puzzles, we have musical performances, we have teachers teaching them how to paint. And so these two services kind of work in tandem in terms of having them come to the center, and they can even take a shower at the center as well. So it all kind of works together in that sense.
Yeah, I think it's wonderful.
Thank you. Yeah, thank
I'm
you for your
sorry it's
question.
late. Where are you based out of, Brandon?
I'm in San Jose. So we have two centers in San Jose. One is in East San Jose, the other one downtown. I'm actually right between them. So I cover all of these two centers as well as the center in Fremont. And there's some high demand lately. A lot of people that are trying to learn more about the program. And a lot of times it's the family caregivers that are starting to feel a little burnt out. And so they reach out and trying to see what services there are that can help with their parents.
Yeah, no, I definitely understand. And this is covered by, Medicare, or is this
Good
kind of,
question. Yeah. So I realized that wasn't touched in the presentation. So um, our demographic, I want to say like 99% of our members have Medi-Cal. So that's really what we target. The reason being that Medi-Cal is going to be fully covering the cost of that program. And then if they don't have Medi-Cal, if they only have Medicare, that's when there's going to be more of a high monthly premium. The reason being that it is such a wraparound program. It is a range in terms of the cost, just depends on case by case. But we rarely have any private pay members. We try and target Medi-Cal, and so that's why we do have some, immigrant seniors. We also have, in general, we're trying to target seniors with Medi-Cal eligibility just because there's no burden of cost on that program.
So
Mm.
can you elaborate a little bit on the PACE program and how that is a program administered through the Medi-Cal system. So, and the families qualify for the PACE program by being accepted into the Medi-Cal system. And if you could
Correct.
elaborate on that, and
Sure.
because Joe was asking about income and assets and
Yes.
how that works.
Sure, sure. So in terms of Medi-Cal eligibility, in the past, they would look at both income and assets. And so seniors with low income would still be ineligible for Medi-Cal simply because they owned a home. Starting, I believe, beginning of 2024, it's been a little over a year now, they actually removed the asset limits. And so, starting last year, when reviewing for Medi-Cal eligibility, they only look at income. They don't look at your savings account. They don't look at if you own a ship, a boat, a house, all of these assets. They're just looking at income, and that has really widened the capacity of like how many seniors are eligible now for Medi-Cal. And like you said, once they're eligible for Medi-Cal, OnLok is one of those options. Again, they're not guaranteed to be eligible for the PACE program. They need to be approved by the state. And so that's why we go through that entire assessment process is to essentially learn more about their individual case, gather their, medical records, and then essentially compile that as a, sort of evidence to convince the state that, hey, this person really needs Unlock's help. We think that they're suitable. We just need your approval for them to join the program. But yeah, thank you for the question. I think Medi-Cal specifically, I know that a lot of seniors are thrown off when they hear about the cost of the program and that like, oh, you need to have Medi-Cal. I think I'm making too much. We actually work with a couple of organizations that can help with that as well. For example, one of our partner organizations, SourceWise, has a program called HiCap, which is health insurance, counseling, and so they're able to find different ways that seniors may be able to circumvent the Medi-Cal limits. One example I can think of right now is a spouse impoverishment Medi-Cal. And so essentially what happens with that is that there's a couple, and usually one senior is going to be less healthy than the other. The other one's going to end up being a caregiver, and that can end up having burnout as well. And so a lot of times what the family does is they'll take that less healthy spouse and they'll distribute a lot of their income towards the healthy spouse. And so now this spouse that's more sick, their income is low enough to be eligible for Medi-Cal. And so now they have Medi-Cal. So there are different ways to circumvent it. There's also working, age blind, and disabled, which is where you don't even need formal employment. You just need evidence from a friend saying that, hey, I pay my friend 20 bucks a month to pick up some cans from my front yard. that counts as being employed, that could also potentially have you eligible for Medi-Cal. So there are different ways in which you can approach the Medi-Cal application process rather than just looking at the income. Um, and another thing I want to touch on real quick, Medi-Cal income limits, essentially people that exceed it, they are actually still eligible for Medi-Cal. They just have what we call as a share of cost. And so let's say, for example, their income exceeds the Medi-Cal limit by $500. That extra amount becomes their share of cost, which is essentially a deductible. Now, in the past, if they had this share of costs and they joined our program, that would become their monthly premium. And so they would need to pay off that $400 or $500 and then be able to use OnLok services. But actually, starting, I want to say 1 or 2 months ago, we were able to waive that cost completely. And so, even for seniors that are slightly above that income limit, and join our program, they no longer need to pay that share of cost as well. So we've been making a lot of changes. Medi-Cal has also been making changes to make it in general to make it more accessible. And then as a result, Unlock Pace has become more accessible to seniors as well. Yeah, thank you for your question. Did anyone else have any questions about that or I don't know, anything about, PACE, senior healthcare,
Yeah, I
anyone who
got a
might
couple
be
questions.
okay.
Unfortunately, I got in late, a
Okay, no
little bit.
worries.
So, is that most of it, the people that move into your facility or they stay at home, or which way is better or whatever?
Sure. So actually I actually mentioned this at the beginning.
Yeah,
So Unlock, really our philosophy is to allow seniors to continue living in their home as long as possible. We want them to keep their independence and also stay part of the community. So we actually do not directly provide housing within our PACE center. Our PACE center is just where we can provide the medical care, the physical therapy, the activities, but we don't provide that housing unless they, join our program later on, they get to a point where they need to move into a nursing home or an RCFE. But ultimately, our philosophy is to keep seniors at home. So we don't want them moving out. Yeah.
I see. So they will stay home, then you will provide a service there.
Can you elaborate a little bit on the utilization of OnLok and your services and the RCFE?
Sure. So this is right over
And
here.
I'll just say for those who don't know what an RCFE is, it's a residential care facility for the elderly, a state licensed board and care home um, that is single family home in nature. It's not multifamily. So that if you have any more questions about that, you can ask me later. But that what interests me is the relationship and that OnLok in this PACE program could be a really good resource for our RCFE owner operators.
Yeah, that's a good question, Julie. Thank you. So yeah, essentially, uh, you know, our goal is to keep the senior in their home as long as possible, but we know that that can't be prolonged indefinitely. There's going to be a point where they lose their independence to where they do need to be in a facility with that staff, with the nursing staff, with medical staff that can take care of them. And so that's where the SNFs, which is a skilled nursing facility, or the residential care facility, those two will come into play. Again, you can see here, this is how many of those facilities we are contracted with. And if it does come to that point where they need to move in there, our IDT, which is our team, they're going to have a conversation with the senior, with their family, just regarding, where do you want to go? What are your wishes? And essentially, there is a placement process. We do contract with them to have a certain number of beds at each facility. And in terms of RCFEs, unfortunately, I don't know step by step exactly how that transition process works, but what I do know is that we do cover the full costs of the RCFEs under the PACE program, and we also keep them under our program as a PACE member. And beyond SNFs and RCFEs, we actually do have a comfort care program as well, which is kind of adjacent to the hospice care. But we do have our own comfort care program for the terminally ill. And so that's sort of like palliative care, keeping them as comfortable as possible after they have a, sort of a terminal diagnosis. And so what really OnLok is trying to stay with our members for life is sort of the philosophy there, and in the sense that they don't need to worry about does my health plan still is OnLok still able to take care of me now that I'm at the level of a nursing home, now that I have this diagnosis? Do I need to worry about changing health plans? The the answer there is really no. And you can see here, 29 nursing homes, 30 residential care. These are all within our network, and we're also constantly expanding our network and contracting with new facilities. And they do have different language capacities, different locations that might be more convenient for the family to see them. So we are really able to accommodate for each person's individual needs.
So
So we
in
have a
general,
question here from Mark. He's asking about, is there a minimum residency,
Minimum residency.
minimum residency period in the area prior to application? So,
Good question. Yeah.
yeah.
Okay. That's a very good question. So again, that has to do directly with Medi-Cal. So 99 to 100% of our members again have that Medi-Cal coverage. We do have people coming in to our program trying to apply that have recently moved over from a different county. And when that happens, we have to actually ensure that their Medi-Cal has been instated in the correct county. So they have to have, even though they've moved here for a month or two, their Medi-Cal might still show the old county. So we really encourage them once they reach out, hey, it's showing, San Bernardino County, it's showing this county. They need to reach out and have to update that. And reach out to the Medi-Cal office and update that so that it can reflect it. Now, if it's still not showing, and sometimes it does take time with Medi-Cal, we are able to have them request a letter from Medi-Cal, and so they can access that letter either physically or sometimes they're able to see that in their Medi-Cal portal, and that letter will basically certify that you've had a change in address. This is your new address, and it'll take time to reflect on the Medi-Cal system, but we are confirming that you are living in this county and you are still eligible for Medi-Cal. And so, yeah, typically speaking, if you've just moved here in the last month and you had Medicaid from another state or another county, that might affect your eligibility just because we want to ensure that it's in the right county so that we can provide those services to you. So yeah, that's a good question. Yeah, thank you. And I see, Joseph, I saw that you had another question earlier. Did you?
yeah, I put on the chat, are you any different than Wellbe Health? That's similar or
Good
how they
question. Yeah.
compare?
So WellBe is also a PACE program provider, also in the same service area, Santa Clara County. Um, there's a couple differences. So, I mean, first things first, OnLok is actually the founder of the PACE program. So, this entire model of insurance was actually created originally by OnLok, and now it's being simulated by different companies, including WellBe. Now, WellBe, I believe they have more experience in SoCal. They actually just came up to NorCal maybe a year or two ago, so they're very new to the area. Another difference is that OnLok has always been a nonprofit. Wellbe is a for-profit company. So, take that as you will, but, some differences in terms of organization. And we have had some good experience in terms of having people kind of window shopping, looking between the differences of the two companies. I won't say too much, but really, I think that part of the experience I've seen from people trying Wellbe is just that because they're so new to the area, they are still working out some of their organization, some of their management. It's still a work in progress, whereas we've been really here especially in Santa Clara County, we've been here for about 20 years. So, we are a lot more situated. We are more familiar with this area. But
Sounds like
again,
it's a
yeah,
similar program, but you guys are more seasoned than
exactly.
particularly in Northern California. I think they are more established in Southern California. They just
Exactly.
opened up their San Jose, I think, over a year ago. Uh,
Exactly.
uh,
Exactly.
uh,
Yeah.
uh, a separate, related question
Okay.
in terms of income. I know you're not looking at the asset anymore since last year, but in terms of income, so let's say if they have a pension income, so they just might need to share costs, but does not prevent them not to join, right? They just have to look at whether they need to share or not.
Yeah, yeah. So that's a good question. I did mention that earlier. So like you said, share of cost is when their income is slightly above the Medi-Cal limit. There are different ways to circumvent to reduce that share of cost. In the past, for example, buying additional dental plans, additional vision plans. But actually, as of, I want to say a couple months ago, OnLok's actually been able to waive the full share of cost. And so if they have a pension and they have Medi-Cal with a share of cost of, let's say, $300-$400, if they join the OnLok PACE program, they actually don't have to pay any of that share of cost anymore. So we're actually able to waive that cost and they can join it fully free of charge, covered fully by Medi-Cal.
What's
I,
that limit again per month? Is 19 something.
The limit, so the limit, it does vary. It depends on if it's a single household, if it's a couple, and then also for aged, blind, and disabled. So there's several different codes for Medi-Cal. I do have a handout that kind of walks through a lot of those limits, but it really does depend case by case right here. So as of 2024, it does depend on single or couple, and if it's linked to your SSI as well. So there's very small differences, but yeah, for a single, if it's independent living, as of 2024, that's going to be a roughly 1180, so 1180. And then for a couple, which is independently living under SSI Medi-Cal, roughly 2020. So there's different types of needs. There's also working disabled, there's aged blind and disabled, long-term nursing home. So all different codes of Medi-Cal. But I think that does change slightly every year as well. I heard
I got
something
on,
else. Yeah, go ahead.
I got on late. Did you cover the location of your facilities in the Bay Area?
Yes, let me go
Okay.
back there. I don't think the slideshow shows the exact location, but this is our service area here. In terms of Santa Clara County, we do cover the entire county. And then we have two centers that cover that county, both of which are in San Jose. One of them is in downtown San Jose by the airport, and the other one is on East San Jose, which is next to Regional Hospital. So that's in terms of South Bay. And then East Bay, we also have a center in Fremont that covers the Tri-City area. And then an exciting development I did not mention earlier, we are planning to expand our program. Right now, it's slated for the end of this year. We're actually going to open two new centers, one in Union City, and then the other one in South San Jose towards, sort of towards Blossom Hill, Santa Teresa area
Nice.
in San Jose. So we are constantly expanding. If it were up to me, I would have had the third center in Santa Clara County a little more, not in San Jose, but I guess that's sort of an organization choice they made. But yeah, all three in Santa Clara County are in San Jose.
No, all that's good news. Now have him look into Contra Costa County.
Right, that's what I'm saying. So Contra Costa, San Mateo County, there's a lot of potential there. And we're constantly growing. We're hitting our census and the demand as the population ages, there's just going to be even more demand for that in the future. So I'm glad we're opening another center because our San Jose center in downtown, it actually just passed 300 members. So,
That's the one on Stockton Avenue?
correct.
Okay.
Yeah, so that one's on Stockton. The East San Jose one is on Jackson. It's across the street from Regional Medical Center. And then the one on Stockton, like I said, it just passed 300. And then we're opening another center. So it's a
I
constant.
actually attended the grand opening of the Stockton Center
Oh, really?
years
Okay.
ago.
Yeah. How was that?
It was impressive, I'll tell you. Pretty
Yeah.
delightful. They had a little parking issue then.
Yeah, yeah. That's, it's downtown. So that parking is can tend to be an issue, but now there's more street parking around the area. And there's also a dedicated staff lot so that we don't take away from visitor spots. So, but yeah.
So,
Yeah.
so that's your membership that comes for services at the facilities, at the places that you have. What about the outreach though? Like, how many members in the area is your organization going out to their homes as outreach?
Outreach, okay. So are you talking about, you're not talking about like home care, you're talking about outreach in terms of like going to their homes to teach them about PACE or
So, or is it the PACE program that facilitates the professionals that go to people's homes?
yeah, so in terms
For
of
home support, so people aging in place,
uh-huh.
the kind of support that they get that OnLok or the PACE program provides.
Yeah. So in terms of going to their home, I mean, part of the enrollment process of joining our program does involve a home assessment. So we do have a nurse that goes to their home, assesses their home environment, their memory, right? This is all part of the process to get them approved by the state. And then after they've actually formally joined our program, the most we do in their home is going to be the home care that I mentioned earlier. So we do have caregivers. And in terms of what the caregivers can do, really, they can do, light cleaning, not groceries, laundries, showering, toileting. The two main things that they cannot do due to regulations with food is the groceries and the cooking. I know that cooking can be a big issue there in terms of having food insecurity at home. We do have home delivered meals as well. So those are prepared meals that we deliver. They just have to heat them in the microwave. And then our home care can actually help with heating up that food, preparing it for them. And then in terms of outreach, since you brought that up, we do, partner with Medi-Cal to send out our mailers with the DHCS, Department of Healthcare Services in California. So all people with Medi-Cal will get that mailer with information on it. A lot of times they'll see that mailer and flyer and reach out to us. And then in addition to that, my team, including me of outreach specialists, we do go out to senior communities, and that does include a lot of senior apartments. I go to a lot of different senior apartments, residential care facilities. I've also had a tour of a nursing home before as well, just to get an idea of the people we work with. And then really the goal is for me to have a presence there and essentially be the face of the program and be that first point of contact. And a lot of times it's surprising people that have heard about our program, they don't know a lot about it. And so when I ask them, sort of like, do you know OnLok? What have you heard about them? They tell me, oh, is it a nursing home? Is it like you move in there, you live there? It's actually the opposite. We don't want you to move out at all. We want you to stay in your home. So, that's really been my mission, has been like, even if they don't want to join the program, at least I can educate them about PACE and then have them be aware of that resource. And even if it's not for them, maybe their friend, their neighbor, their family is struggling with their independence, and that might be something that could help them as well.
So you had
Brandon,
mentioned
Brandon.
earlier, oh, go ahead.
Thanks, Jules. Can I call you Jules? No, Brandon, you know what, my question to you is like, if one of the things that you're doing is outreach, because that's what I did for 20 years. I am positive with 100% confidence in every cell of my body
Okay.
that there are multiple home care agencies that are private pay in your
Yes.
community that are getting calls all day, every day. That should be circumventing a lot of these calls to you.
Hmm.
I mean, they should, because they should be sending it somewhere. I mean, also CCRC, Coast Caregiver Resource Center, I'm so sure. I don't know if that's what they call it there, because on here they call it the coast, but CCRCs are all over in each county where they're getting calls for people that need help, especially too. So, um, if that's something that you need help with, I'm happy to connect you with these, home care companies that just are, should be just as equally as trained on not just to convert a paying client, but what do you do for people that just can't afford these?
Yeah, so sort of like you're talking about people without the Medi-Cal that might be still seeking home health, but unable to access PACE in that sense, like sort of
Well,
the
I
people
mean, you're
falling through the
saying
gap.
you don't really handle a lot of people because they don't have the money. You're really focused on people that need, 100% reimbursement, but that middle class we haven't just enough, but not enough,
Yeah.
to get crushed. So they would pay privately because
Yeah.
it's a better end to the means, because you can't afford, $1,000 worth of home care a day.
Yeah. Totally. Totally. Yeah. So
So
that is something that we try to. That's a very good thing you bring up because I do see that sometimes at my events when I explain the Medi-Cal coverage. A lot of times people that are more towards the middle class, they tell me, you know, we're not poor, but we're not rich. So they tell me, we're right in the middle, and you guys, there's got to be something there for us because we can't afford, like you said, these services that charge for each day, that charge these amounts. I think that would be really helpful if we could, connect, and then maybe you could let me know some of those home health agencies, just because a lot of times this is something that also occurs as well. People that approach me to join the PACE program, I find out that really what they're looking for is just support in the home.
yeah.
And our program is a center-based program. We provide most of our services in the PACE center, but they're telling me, I want a caregiver on the weekends. I want someone to take care of them in the evenings. We might not necessarily be able to provide all of that. So sometimes I do have to direct them in the right, towards the right resource.
Yeah, what you want and what you can afford, and also what is a more sustainable plan. People can't just, can't decide that you understand what's better for that. Yeah, that's what you want, but does that make sense? And is that sustainable? That's kind of like where it's at.
Yeah, absolutely. I mean, I think sometimes that's where having the knowledge of partner organizations like SourceWise or maybe some of these home health that you're mentioning, that might really be good to know in the back of my head so that if the time comes where PACE is not an eligible solution for them, then I can act as sort of an advisor and sort of be like, hey, I think you might be a better fit for this. Maybe you could look into this
No,
program.
what I'm saying is they probably have a lot more people that they could refer to you.
Yeah,
You're
that's
getting
true
phone
too.
calls. Yeah.
Yeah, that's true. So I think it goes both ways, but absolutely. I mean, more people do need to know about PACE because there's a lot of misperceptions about it, I think. They don't know that we provide home care. They think that we're just like a nursing home. We just have doctors, but we actually do so much more than that. So
Just to be
thank you.
clear, on your meal program, it's not a Meals on Wheels, is it?
No, it's not.
Okay,
I think we only have one or two members that are members of PACE and receive Meals on Wheels. We are partnered with them. I recently visited their facility in San Leandro, but we do partner with them, but our meal delivery service is outsourced by another company.
okay.
Yeah. But I do have some members that receive Meal on Wheels, join our program, and it does not affect that eligibility. So they're able to just get both programs at the same time.
So one of the things we had talked about earlier is the multi-generational family. And some of the conversation that we just had with Jessica about the caregivers and stuff, some of those objections or pitfalls, challenges might be coming from the adult children. So the adult children, they might feel you have a multi-generational household, and the adult children might feel that, well, my household probably wouldn't qualify for any kind of these programs because, we are the breadwinners of the household. But if we inform them that their parents might very well be very well qualified for a PACE program or similar, and that it could be super beneficial to them to have help taking care of their parents, because that just makes them it's a better household. And for us as real estate professionals too, this is one of the things that we serve in that capacity, is to create the optimal situations for families to preserve the aging in place, aging well, or aging in the right place as a family. So that would be, it's the adult children. What do you think about that, Brandon?
Yeah, no, that totally. I mean, a lot of times when I'm working with seniors to enroll in the program, I'm actually working with their children. So that's a really good point you bring up there. A lot of times, I mentioned this earlier, but the family is starting to feel more and more of a burden in terms of like I have to take time off work to bring my mom to the doctor. I have to manage so many of her appointments. And so there is that struggle of sort of feeling the guilt and feeling the burden of like, my parents are getting older and a lot of times they have their own kids. So, like you said, multi-generation, right? They got to take care of both sides. And so, really, the goal of OnLok is not to just like take the parents off their hands, but rather we want to work with the kids directly and have that working relationship. And so, we'll directly work with them in terms of, creating a MyChart account with them so they can access their medical records, communicate with their doctors, giving them reminders, providing that transportation, providing interpreters so that they don't have to worry about the communication process. Um, Ultimately, the adult children, I think, is a sort of an untapped potential that we can really target as well in terms of like, even if your income is not eligible for Medi-Cal, your parents might be. So that's a really great point you bring up. And then again, a lot of the people I work with, they move their parents here from out of the country. And so basically, by definition, they don't have an income, right? So those people are very much eligible for Medi-Cal even before they are getting their green card, actually. So, that's something to consider is that more of these recent people immigrating to the US also very eligible for Medi-Cal as well.
Yeah, and to what Jessica was mentioning earlier too, if our local caregiving agencies had a little bit more knowledge, working knowledge about these services available, because I think they're complementary and can be very collaborative.
Well, I
Absolutely.
don't, I don't say, I don't know about, not, because it's easy for me. It would be easy for me to help you, but like, I know like in, Riverside County, which is not your county, but, I know about like an assisted living, home care company that they said they get about 50 phone calls a week, which is a lot. I would have gone like 20, 10 is a lot, but they're getting this bigger area. Anyway, they said more than half the people just don't have money, period. And so I just think that these are trained to, they're really being put in a position like some locally in these areas where there's probably, a little bit more people that could use these supportive services, that there's so many silos in this industry that's happening. That's why I really appreciate what Julie's doing, is because it's really about connectivity and community and helping each other. And there's people with less money and less support, yet these private pay companies aren't doing their due diligence of learning about these, because we're here to help. I mean, we're all supposed to be of service. And so they need to really get the education. And I'm telling you that a lot of these companies that are private pay are getting these phone calls that would have these, they should just be doing a direct referral and doing a lot of the education for you. A lot of, this just, hey, call this number, because they're calling for a caregiver and say, look, here's some other options. And and it's a trusted source, right? Because it's an established company. And that's what I think it should be happening.
Yeah, I totally agree with that. I mean, especially for people, that are medical eligible, but then unaware of PACE. Sometimes I feel like people can fall between the gaps, fall between the cracks of these different services, especially if there's not enough awareness going around about that. So that's really what we're working on. And I do think that it would be beneficial to partner with more of these private pay companies because we could kind of, in a sense, we could complement each other because if these people cannot afford your service, then best thing you can do is to guide them towards someone that can. And then, something I didn't mention earlier, for these families, sometimes we do recommend them if they want even more home support to have another private pay caregiver. And so that could be another partner organization there too, where it's like, they can provide some support on the weekends, private pay, but because the PACE program is free, if you have Medi-Cal, you're just putting some of that money towards the additional caregiver service from that
Mhm.
company. So it could be a little symbiotic relationship. I
Yeah,
think.
I totally think so.
Yeah.
Yeah, now I got lots of ideas. Uh-oh. Well, that's just been amazing information to have, Brandon. Thank you so much.
I do
Thank
have
you.
one question and
Go
sorry.
ahead, Lynn Lynn. Hi,
Yeah.
Lynn Lynn.
Hi, Julie. I'm sorry. I was
No,
kind
no,
yeah,
you just go,
like
girl.
Joseph just kind of jumping in a little later, but out of all of your clients that uses the OnLok PACE program, what percentage are Medi-Cal and what percentage are Medicare? And then I have a follow-up question after that.
Sure. I don't know the exact number, but again, from my knowledge, I believe we probably have, like, I could probably count on one hand how many members do not have Medi-Cal. Again, because the monthly premiums can range so high. So I want to say 99% to 99.9% are going to be Medi-Cal, most of which have both Medi-Cal and Medicare. And then the
Um,
rest of them either don't have Medicare or don't have Medi-Cal, or they don't have either at all. So
Oh, okay.
yeah.
Okay. I was specifically asking because my parents have Medicare and they
Yeah.
have supplemental insurance, but like I was thinking specifically of your program where my sister actually is their caretaker. She's not
Okay.
getting any income from anyone except, my dad gives her a little stipend. And she may need a break. So is
Yeah.
she able to like bring them to these programs during the daytime so she can, you said like these centers, they can be attended to and have activities and the caregivers can have showers during that time. Is that what you were saying?
So ultimately it is a wraparound program. Let me just show you the services right here.
Yeah, and sorry if you repeated this
Oh
prior.
no, you're good. You're good. So this is the PACE Center here. This is all the services that are provided in that one building. So unfortunately, you're not able to pick and choose. So if they do want to join the program, they do need to get the medical care, the activities, all of that. And then we do have a shower room. That's for our members. So that's for that's sort of for the parents to take a shower. A lot of
Oh,
times because if they shower at home and they live by themselves, that's a fall risk.
oh
Sort
yeah,
of.
got you.
Yeah.
Okay. And
And
there's
then,
somebody that attends, I mean, that helps them do that when they're
yeah,
in the
yeah,
car.
yeah.
Oh, okay, okay, got it, got it. Okay,
And
that
then
makes sense now. Okay.
something I mentioned earlier you might not have heard, but I know both of your parents just have Medicare, they don't have Medi-Cal. So one sort of clause in terms of Medi-Cal that can help to circumvent, because I do know that their income is probably above that Medi-Cal limit. They're not eligible for Medi-Cal. There is something called spouse impoverishment, and that's essentially where one spouse that's unhealthy and the other one's healthier,
Mm-hmm.
you'll sort of redistribute their income.
Mm-hmm.
And so one spouse has a higher income, the other one that's not as healthy, they're eligible for Medi-Cal now. So
Mm-hmm.
that's sort of one possible avenue you could take. Again, I know that means that both of your parents wouldn't be able to join the program. So what I would recommend if you are interested in the program and Medi-Cal is to
Yeah.
look into SourceWise.
Mm-hmm.
Um, SourceWise is a really great nonprofit that provides a lot of counseling and health insurance guidance services. So
Mm-hmm.
we do work a lot directly with them, and they're able to guide people in terms of both Medicare and Medi-Cal. And then also they're a really good resource hub. So they're also really good at what do you need, what do you want to get done. I know where you should go.
Mm,
We've
I
had them present before.
Yeah, I was going to say that I believe I'm just looking at my phone book to see if we have the contact for SourceWise. I'm sure it's in one of the Julie's many emails. Oh, Kayla Chen
Yeah,
presented I think, from
yeah.
There
SourceWise.
you go. Yeah, they're really great. We work with them a
Oh,
lot.
oh,
So
good, good.
they
Okay.
taught, they were able to teach us about some of those Medi-Cal
The
short
source,
costs.
spouse impoverishment. Okay, so if we had just connect my parents with source, well, my mom, she's probably the more that would qualify because my dad had the income. She unfortunately has dementia.
Okay, I see.
So but he's also not well. He has metastatic prostate cancer. We have all
Okay,
kinds of issues in our family. So
I
anyway,
understand. I
yeah,
understand. And
yeah.
then
You're,
do they live within the service area here?
Yes, they live in Santa Clara County.
Okay,
Yep. They're
good,
just down
good.
the
Just
street
making
from
sure.
me.
If
I'm
you're
very
interested in
helpful.
pursuing that, you probably would want to contact an attorney that specializes in Medicare and Medi-Cal.
Oh, what kind of attorney is that, Skip?
An attorney that specializes in Medicare and Medi-Cal.
So we
Oh.
But
actually,
Lynn, you've been already, you just talked to Melinda, right?
Yes,
Melinda Coggill, yeah, and then she directed you to the Social Security.
yes.
And then, so kind of all of this is part of the process that you're in now with that.
Oh, okay.
Yeah.
Well, it was actually for a potential client, but for my parents, maybe source wise would be, I don't know, the best.
Oh, yeah.
Yeah, because there was somebody who was asking me about Social Security. I'm like,
Oh,
um,
yeah. Oh, yeah.
yeah.
Oh, yeah.
Good
Yeah.
luck with that.
Well, you're on the right track. She gave you a really good,
Yes,
you
she
know,
gave me some
direction.
good resources, so
Yeah.
I already directed him to that. Yeah.
Yeah.
Mm-hmm.
All righty, everybody. That was amazing. Does anybody else have any questions?
No, happy 4th, everyone.
Happy
happy
4th.
for
Thank you.
So, we're gonna say thank you to Brandon, and we'll have you back. I think we'll have to keep you in our queue at least a couple times a year, so you can keep an eye on us, and we can keep an eye on you.
yes.
Because it does give me a lot of ideas on doing what we do and working with our senior homeowners and families of senior homeowners, and how we can integrate these services and the OnLok services into our conversations with our clients. So I really appreciate your participation here. All
Thank you so
righty,
much.
we're gonna let Brandon go, and then I got a few more things we can talk about.
Okay. Thank you all. It was nice seeing
Happy 4th
everyone.
of July.
Happy 4th. All right. Have a nice day, everyone. Thank you.
Thank you.
Bye.
So, okay, so the first thing that I thought of, and with WellBe Health as well. So WellBe Health in our market in Santa Clara County is the other PACE provider. And as Brandon mentioned, WellBe Health is the for-profit. And Jessica, WellBe Health has locations in Southern California, but I don't think in your county. But I'm going to send you their information. I've got it in one of my bulletins. And then you can compare and contrast. There are just such good resources to have, whether it's nonprofit or for-profit. It's still the PACE program. And this program is indigenous to, of course, California. However, every municipality, county, and state most likely has a similar program. The hard part is learning about it, and then going to your municipality, going to your county website or your state website, mostly county, and then identifying their area aging agency, and then honing in on what that agency provides your municipality, like Santa Clara County contracts with SourceWise to do just that. So, it is, and if it's that much work for us, could you imagine how much more work it is just for the average consumer, homeowner, and adult child? I don't know. What do you guys think?
You're right.
Don't all speak at once.
In my experience, Medi-Cal is extremely complicated
Here.
and
Hmm.
it's very difficult to do on your own. I had to hire an attorney to help get my mom on Medi-Cal because I made the mistake of making her a joint owner on my account.
Oh.
And I was advised to do that. The reason being that I've had a few illnesses along the way, and I wanted my mom to be able to get into my accounts if I got incapacitated or needed the money to pay some bills, whatever. But because we had a joint account, they considered my money, her money, the entire amount. And I tried to explain to him, no, these are commissions I get as a realtor and they're in my accounts. And here's the reason why I have mom on my account. But I literally had to have an attorney to unravel this and get my mom on Medi-Cal. In the meantime, it cost her $16,000 to be at Manor Care for the first month and a half before I could get her on Medi-Cal. So I strongly advise anyone to go to an attorney and figure all this out. They make it extremely complex.
There are also people that specialize in doing placements for Medi-Cal services, like Medicare Advantage and so forth, and they would be good too. But you're right,
Medicare
legal.
disadvantage, I would call it, but, and you know, placement companies actually cannot get paid to do a placement for a Medi-Cal or anything that's Medicare, but they would charge, but it's actually illegal to place somebody in a skilled nursing facility. They
Well,
can charge the family wants to pay for that fee, but the skilled nursing facility or medical will not pay. Unless it's like a CCRC, there might be some, because it's a assisted living community, but
well, the point I was trying to make is that you're right. It's so complex. You really have to have an attorney or somebody that knows what they're doing to be able to address the legal side of this. Otherwise, it could happen just like it did with you, where you thought you were doing the right thing and it turns out that the law says no. So that's what we pay all the big bucks to the attorneys for.
Yeah, it ended up costing us about $10,000 to unravel that mess. I had been given some wrong advice by one of the nurses that, you know, explained these things to us while mom was in the hospital. So anyway, just something to be aware of and to do it before you need it. That that will save a lot of distress and stress. And there was another point I wanted to make, but I forgot. Senior moment. I'll, I'll think of it in a minute. Sorry.
Carol, go ahead. Carol.
Me? Hi. Hello.
Hello. Yeah.
Sorry I was late today.
No worries. No, Barbara's background looks so pretty.
Doesn't it? I mean,
Doesn't it?
let's all just go there and zoom out.
I know.
Thank you, Barbara. I feel when I look at you and this gorgeous background, I feel a sense of relaxation and warmth and fond memories. So I thank you for that.
Wonderful. Wonderful.
Oh, really? I would
Yeah.
love to go there. That's definitely on top of my list of places I might run away from to. But the language.
So, did anybody like get any connections with your clientele, your circle, your database with some of the information that we got today from Brandon at OnLok?
No,
Skip, you're such a grump. Grump.
I think if I were able to work with somebody successfully to sell their policy, I think that might disqualify them from many social services because then they would have cash.
well, it depends
So-
on what you do with it, though.
Yeah,
That's
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 part of
where-
what we do as seniors real estate specialists is to guide.
Well, no, you're getting offline here. That's more legal aspects, and you don't want to be giving legal advice.
Not legal. That's not
financial.
legal. Yeah,
Well,
okay.
yes, it is. It is because if you tell them to do something with that money or that policy and they do it and then find out
No,
It makes them ineligible.
we don't
for
tell them
legal
what to do.
services.
We tell them the resources to go to find out
Right.
what to do. We're the resource for the resources.
All right, that's not how you explained it.
No,
Well, I wa-
that's actually how I got it. That's how I understood it, because that's also how I was thinking. If I can provide them with the money, one obstacle, or depending on how you look at it, one obstacle is that oftentimes the money that I get them is a larger sum at one time than they've ever had before. And with no strings attached, they don't know what to do. So as Julie said, if it's a senior, and especially if moving or getting an ADU or something like that were in the cards for them, then I would absolutely refer them or call myself to Julie and you, Skip. I mean, the people within this group, I believe, are the ones that can, like a financial advisor, like Skip says, can provide the ideas and the knowledge they need to where they can place the money, where they could still benefit from having it. However, make sure it doesn't get in the way of anything else they might be able to get, any other benefit.
yeah,
And
yeah,
I can't do any of that
no.
because of licensing. All I can do is find the buyer for the policy and make sure they get the cash. But we can start working with them way before they actually get the cash. So if
Yeah.
I see, for example, when somebody comes to me, it could easily take up to, let's say, 3 months before I gather all the proper information, because the doctors need to cooperate, the insurance company, and then I send it out to bid to multiple different companies. If I start getting offers to buy the policy back, that's when I know, okay, one way or the other, this person's going to be getting some good money. So now, even though it may take me another month or two to finish up all my legalities, and then they get the money, by that time, Julie can have a team in place even, or refer the team of who can help them, because we'll know how much they're going to get. And we'll know then, before they get the money, what tools are available so we could have your referral work directly with the family's own advisors or agents while I facilitate getting the funds themselves. Did I?
Yeah, and I'm just gonna make clear for the benefit of everybody in the group who might not know that you do life settlements. So
Thank you.
the net proceeds from a life settlement is a non-taxable event.
Well, not necessarily. There are two different kinds of life insurance settlements. There's viatical settlements for the terminally ill, which is how this all began 35 years ago. Then, when people with AIDS in particular had access to medications that were extending their lifetimes, my industry discovered that 9 out of 10 life insurance policies never pay off by the life insurance companies. People find they get unaffordable, or they don't need it anymore. Maybe
So
they just don't
what's the
want
case
it.
where it becomes a taxable event if they sell
Okay,
their?
well, the life settlement, because people with AIDS are living longer, the government got in the middle of it and defined terminal illness as 24 months or less. That is within HIPAA. So if somebody is a terminal illness, they get it completely tax-free. So when you're considering terminal and seniors, anybody who's a senior with a terminal diagnosis or not, if their health is seriously compromised and they expect to be living 2 years or less, it should be tax-free.
Okay,
With a
so and
life
then and what
settlement,
in
right,
what case is it a non-taxable event?
right, that's with a life
And so
settlement.
in what case is it a taxable event?
I'm going to explain that.
Well, we're
What
gonna
they
go over
get,
that too when you're here on July 29th.
they don't necessarily tax the whole settlement. What they do is first take out the cost basis. So all of that comes off the top. The remaining part can be taxable. However, that goes back to their own financial advisor to figure out how to place this money and hopefully save taxes. I don't have those tools, but I know that they're there.
Yeah. So similar to what we do as real estate professionals, and we have a net sheet, and working with our clients who are experiencing a net. We don't make them, or we don't make recommendations to what to do with it. We refer out to all of our professional affiliates for the clients to reach out to, for them to
Exactly.
gather their own information and make
Exactly.
their own decisions.
Exactly, exactly. So we don't want to be in the middle of telling them what to do, just educating them as to all the options available. And here are people that can help you deal with any of those options that are best for you that you choose.
Yeah.
Same
Yeah.
exact thing. I advise, I educate, I broker, I get them the money. And then I get to say, you know, go have fun. Do whatever you want with it. They don't have to pay it back. There's no interest, and there are no financial requirements like a reverse mortgage either. You know, so all they need is the right age health combination, which I can determine on a phone call, and a
So
policy.
we'll learn more about that when you do your
Yes.
presentation.
And I'm looking forward to it.
Yeah, we are.
Thank you, Julie. It's
Thank you.
exciting. It's fun stuff.
Thank you for that information. I remember what I want to ask or mention.
Perfect.
Is that-
Awesome.
Anyway, when we do a trust, there is a special trust for long-term care or something. I don't know all the particulars on it, but I
Yes.
had an attorney friend, his mom had provided for her long-term care in the trust somehow. So if you know anything about that, please share.
I do remember now that you mention it. I don't know the name of it either. It's kind of on the tip of my tongue. But there is some kind of a financial vehicle, like we have our retirement funds, our individual IRAs, that can avoid taxes or lessen taxes. This healthcare type of trust also provides ways to do the same thing. Excellent, Barbara. Really good point. Thank you. I'm going to try to look into that before my next presentation.
Well, so that's a really good question for a trust attorney in estate planning. So, and we have resources for that, Barbara. And
Okay.
we may need to teach them. You know, it may not,
or
unless
learn from them so that we know.
both.
Yeah.
Yeah, both. I would think that many of them, it's not even on their radar if they're dealing with younger people.
Oh, no. We have
know?
in our network, we have estate planning attorneys and trust attorneys that work with the
Well,
senior.
just seniors.
Yeah,
Good.
yeah.
Okay, good.
Yeah.
So hopefully they all are very well versed in this, which means they should also know about life settlements, which is unsettling to me. I didn't mean to do that pun. It's
Oh,
unsettling
you're so
to
funny.
me. Because, I mean, just yesterday I met with a financial professional who, for 35 years, has worked with companies, small and large, who are going through transition. People are retiring, they're merging with another company, being bought out, and they have key man policies that could have been liquidated possibly to give the money right back to the company when that executive is leaving. Yet this
So
man,
that sounds like a marketing plan to me right there.
well, but I've been doing it for 30 years. People just don't, I can't tell you, they hear life insurance, and I think that they assume immediately that I'm a life insurance agent and I'm going to sell them something, but they just blank out. It doesn't sink in what I'm saying. But this gentleman, he had never heard of it before.
Right. Something
And-
that we're gonna have to educate the public on.
Yeah.
All right, everybody, any more questions? Everybody gonna have a great 4th of July?
Oh, yeah, yeah.
Yes.
I'll be writing my new website.
Never, oh, I know, me too.
I
Working on
enjoy
that,
it, but
working
my
on this.
website is vintage. So I need to get that going.
Right? All right, everybody, you guys have a great week. We'll see you next week. Next week, wait, don't go anywhere. Oh. Next week, we're having the Real Estate Advocacy Alliance. The Real Estate Advocacy Alliance was formed to help elevate the practice of real estate in our state of California. They are allies for us as real estate professionals. They come from our business. This is unique to California. They're a heavy presence in Sacramento right now, and we
Good.
have so much stuff going on right now. We're just going to learn so much from them next week. I'm so excited. So you
Good.
can review their website. It's on page 1 of the bulletin, and we'll see you guys next week.
Thank you so much, Julie.
All
Have a
right,
great
I'll see you on the
holiday.
computer.
Be careful out there, everybody. Bye-bye.